guys, welcome. I'm Dr. Alekhya, your orthopedics faculty at PW Med. So guys, today in this video, we are going to understand about the residency program. So you all know that we have started this Residency Explorer series, and now it's my turn to tell a great detail about orthopedics. And at the end of this video, I'm going to tell you the female factor of orthopedics, which you all want to listen since I've entered PW, right? So let's keep the best for the last, and now let's start with the how do you actually get attracted to orthopedics. And this video would be useful to all those aspirants who want to consider orthopedics as their career and who've already selected orthopedics as their dream branch, right? So guys, for me, orthopedics was actually, when I was doing my internship, I actually got exposed to this particular department, which was very, very interesting for me. So I'm going to tell the orthopedics, especially in my point of view, right? So let's get started. So I feel anybody choosing medicine as the career, once they enter into the medical school, you will find everything as Greek and Latin, because it is very, very new to us. Even though we have this biologic background, intermediate, like in our +2, we would have learned more about animals, like we had the section of cockroaches, frogs and all. But once we enter the encounter with the human body would actually be very, very, very special to us. So once we complete this first year, second year, slowly we get into the subjects, we understand where actually our mind is taking us to. Either we are interested in medical branches or surgical branches. For me, it was always the anatomy which was very interesting in the first year, followed by pathology in the second year, and finally landed up loving general surgery in my final year. So maybe for you all also, you can assess whether you're liking more of anatomy or more of physiology, because anatomy drives you towards the surgical branches, whereas physiology drives you towards those medical branches. So once you finish your all your 4-year subjects, you would actually put few subjects as your favorite subjects, right? And then this liking or picking up a branch starts right from your internship. So once you get posted in various departments, you get to encounter various cases, various type of people, especially various good doctors. So first liking is towards those good dynamic doctors, and then you fall in love with the subject, right? So for me, it was like when I entered the internship in the orthopedics department, I really felt very happy because there was a lot of work to do. And I was the person who wants to work a lot than to sit and study. So I can't study for a long time. I always wanted to do something. So in orthopedics, it was always on your toes. Like you have to attend the OP, you have to see the outpatient department. Then you shift all these patients into the procedure rooms for putting casts, removing the slabs, small suturing for small wounds. And then you have your OT schedule. You have to schedule the patients for the OT. Then you have to order the implants. Then you have to prepare them for the OT. Then post-op, then rounds. So the round the clock, you have some or the other work to do in this department, right? You were never free. And compared to the other departments like dermatology, ophthalmology, or ENT to some extent, the work schedule was limited as an intern there. So somewhere I was so attracted to the work pattern here, and I also loved the subject of dealing with the bones, those reduction, traction, putting up slabs and all. It was so interesting for me. Then after clearing my NEET, it was then the state exams. So after clearing the exam, I've got seat into this orthopedics. So there was a seat vacant there, so I opted for this. And now actually this game actually started after entering the department. So till now, it was all the dreams which I had, I have to become that, this and all. But the reality I faced is after entering into the department. Guys, it is never easy in the first year. So now the explorer of this residency will start right from the day one, because you don't be treated as someone who has just come. You have not like a little baby. You are treated as if you have given great responsibility of the patients, as if you know everything there before. So you'll be treated like that from the day one. Nobody comes to you, welcomes you, or they ask your name and all. It is like you've come, now write the repeats, go to that patient, go to this patient. It was like that. So actually took a lot of time for me to get adjusted in the department, but I was little fortunate because I already had a female senior in the department, and she was supposed to be, she was like, fortunately, she was my far relative. So I got this little favor of, knowing about the department, about that particular department in the college before I entered. And it was a little bit easy for me to understand the professors and their working pattern there. So your first and foremost year is very, very, very important. Why? Because this is the time where you get trained properly. You have to train your mind first, then you have to train your body first. So this is pertaining only to the orthopedics part, because I can't talk about other departments. But coming to orthopedics, you have to be physically strong. You have to be mentally really very strong. Right? Because orthopedics is such a dynamic branch where you need to understand the pattern of that particular fracture, especially in the operating room. And based upon that fracture, you have to react immediately and then change the plans accordingly. So you need this training of the mind when it comes to the operating room, right? But coming to the first year, you have to actually take care of the patient right from knowing their HB levels, right? So you have to plan the patient for the surgery. So that is your duty as the first year, pre-operative planning, which is very, very important, right? So during our first year, we'll actually get posted in the wards, taking care of the patients, the pre-operative patients, the post-operative patients, preparing the patients, attending the OPDs, and all this work to be done by us. And we are the primary contacts. The first years are the primary contacts of the patients. So you will have the first meeting with the patient, which is very, very precious according to me. Actually, who meets the patient first will have lots of information. So I was always on my toes in casualty to meet the patient first than anybody else, because I want that first-hand information. So you have to always be ready to attend any emergency, because trauma is one area where you have to be available 24/7 if you are on duty on that particular day. Right? So the first year was very busy, very hectic. I actually lost weight of some 3 to 4 kgs, because you keep running all the time. You are responsible and you are the junior most, because you're answerable to many others like your seniors, your assistant profs, your associates, and your HODs and all. So it is with some tiring, but what you have to remember is it is all worth it. How much you work in the first year is the work you learn in that particular department. So don't neglect the first year. No planning of tours or no weddings, no kids, no family pressures in the first year, especially in the first year. So if you are planning to take up residency, especially orthopedics, look that your first year is peaceful. You have to spend a lot of time in the wards, a lot of time with the books, because that is the time where you keep absorbing things. So your mind has to be cool and fresh and receptive, right? So that is how the first year goes on, and in between you have this thesis submission. You have to select your thesis topic. So collection of the material regarding your thesis also goes hand in hand in the first year. So by the time you complete your first year, you enter the second year, you have this, the juniors coming into the department, which is most happiest moment, because you can hand over all the work to them, right? So that is not the case all the time. So what happens is in the second year, usually we get posted in the peripheral postings. So peripheral postings are the area where again you are new to that particular department. For example, we were posted in emergency medicine, we were posted in the PSM, and then we were posted in various subspecialties of orthopedics like orthoscopy. Then we have been exposed to spine, then oncology, like that. So again, it is a new game again altogether. There you have to understand the consultant there, plan your OPDs, OTs according to him. So again, it is a new dynamics which is happening. And now here, what is there is you have all the basics which you have collected in the first year, right? So it is now easy for you to add or accept the additional information. Like for example, I was posted in the scopy. Then you can understand what is actually the scopy is all about. How do you put an orthoscope? What are the techniques, new advancement? What do you learn in orthopedics according to the subspecialty? right? So that is how your second year goes. But again, remember, your thesis always comes with you till you submit the thesis. So again, second year is a period where you have to actually complete your thesis. 80% of the thesis submission should be done by your second year, because final year is where you will actually be very busy, because you are the important person in the department. By the time you enter the third year, you become more responsible. It is like you are the eldest son or eldest daughter of the department. Everything will be given to you. Every small event which is happening, or every exam which is going to that, or whatever thesis submission, your article submission, your papers, you have to attend the conference, national conference, state conferences, then you have to prepare this presentations. You become so busy in the final year. So second year is somewhat little bit, you get that relaxation. So I prefer, or I advise all my young residents to start your preparation from the second year itself. First year, it is like you collect the material, you have to understand what to read and from which book and all. So second year is actually you have to start your preparation. And coming to the final year, so important year of the life, right? Whatever we have been dreaming of, all this 5.5 years of MBBS, your NEET PG preparation, then 3 years of your MS or MD comes to an end by this year. So you have to put all the effort, all the love, everything of yours into that particular year and finish your exam. There you have to actually, in our department, it was the final year. We used to have this classes for the juniors. So the final years will take classes for the juniors, like explaining them how to do the case taking, presenting the case and all. So this is one part very, very, very annoying, that you need to understand. You need to read every day. You need to take up the case every day, understand the case, present the case, learn again after that. And again, you go back and talk with your consultants regarding the mistakes you made, correcting them, learn to how to do the test, and again presenting the case the next day, next time. So it is like in the third year, you keep learning so much of the content. And actually, the third year is the place where you get to decide which case to be posted in the OT. Then you finalize the OT list. Then you start ordering the implants. Then you check for all the instruments before the OT. Okay, so there is a lot of work which you have to be done. And sometimes you can take help of the juniors. So this helping or taking help from the juniors is actually training the juniors. You don't actually tell them or order them, you actually teach them. So once you tell them, for this particular surgery, you have to order this instrument. So this is how you teach them. At the same time, it is like a help for you, because after 2-3 times, after you teach them 2-3 times, they will be ready to do it by themselves. So you can allot this time for your personal growth, like reading and preparing for the exams and all. So that is how the residency program works. You have to be in the department all the time, especially for orthopedics or trauma, because there is a lot of work which should be done and a lot of reading which should be done. That was a myth which I had, like orthopedics is little bit of learning, more of working. It is not that way. You have to read. There are a lot of books which you should read for more knowledge. And now coming to the post-MS. Post-MS is the area where you have the subspecialty of orthopedics. Orthopedics is now again dividing with its branches into orthoscopy, which means the sports medicine. Then you have your spine, which actually you give your competition to the neurosurgeons. And then we have the oncology, orthopedic oncology. And then we have pediatric orthopedics, very, very special branch. And this is one of the most special branch, because this is where you be with the patient throughout his life. Like if a patient comes with CTV or what is, you treat them, then you see him walking, you see him, getting back to his normal life. Then for the follow-up, he is with you entire life. So that is how, you get happiness through pediatrics. But sometimes it is very depressing to see all these tiny tots with a lot of orthopedic problems and their issues. And then coming to the hand. So hand is also now upcoming branch in orthopedics, where you can take hand and microvascular surgery. And it is again subspecialty to plastic surgeons also. So there you will get a little bit of hand between plastic surgeons and orthopedics, but always you will have your set of patients. And then Arthroplasty, most emerging branch, the plasty. That is now the replacements, the total knee replacement, the total hip replacements, which have been they have now become the part of every surgeon. Every orthopedic surgeon is now trying to operate on PKRs and THRs. So, but still there is scope of a lot of learning in the plasty department. So these are all the subspecialties where you can choose your path again. So you can narrow down your path from the general trauma to this subspecialties. But what I want you all to remember is the chances. We usually keep asking, ma'am, what about the hands-on? Do we operate from second year or the third year? So the answer for this is actually what we operate and how do we do that is only a part of it. The actual process of taking care of the patient starts right from the OPD. So once the patient comes with a fracture, how to put a slab, how to immobilize that particular fracture in a particular position, and then how to prepare the patient pre-operatively so that the patient is optimal in her general condition for the surgery. This is very, very important, especially for the geriatric patients. So when we deal with geriatrics, you have to give the utmost care to them so that they don't land up in any other further complications, right? So this hands-on actually starts from maybe end of the second year. And third year, we actually get to do certain regular procedures like tibia nailing, femur nailing, hemiarthroplasty, especially the external fixators, because open trauma, usually we do it in emergencies where the third years and the SRs are only available at that particular day or that time, usually in the night time. So a lot of X-fix you tend to do. So these are, and patella TBW. So these are the procedures where we actually perform in the third year. And once we enter into the senior residency, you can operate every other case like forearm bone fractures, proximal humerus fractures, and every complicated case like the fractures around the tibia, around the femur, the distal femur and the proximal tibia, the ankle, the foot. So the chances keep coming to you as you evolve as a surgeon. But what you have to remember is concentrate on the basics right from the first year. Tend to learn more and more from different surgeons you meet. So each surgeon has their own way of doing the surgery. So if you like a particular surgeon for a particular surgery, you can definitely follow him for that particular surgery. So this is how you take advantage of everyone you encounter in your life during your residency program, your senior residency program, and then your fellowship. And then now finally comes to the part where you want to settle in India or you want to settle in abroad. So we have this opportunity of settling in abroad, especially for United Kingdom, that you can go to London, where you have to give your MRCS. So this is the exam which is conducted by NHS, the National Health Scheme there. So this has been divided into two parts, the part A and part B, where you can give these two parts in India. And once you get qualified through this exam, you can practice in London, but not as an orthopedic surgeon. There are certain levels which you have to go through. So once you clear this MRCS exam, you will be given a ST3 position there. So as you perform, you will be promoted to various levels, and finally, over a period of time, you can settle as a consultant in United Kingdom, there in London. And then we have this opportunity to go to the one more country, that is Dubai, where you have to give the exam there again. The UAE will conduct exam, and once you clear this exam, you can directly go there and practice, right? So there are different pathways you can choose after being a surgeon, after clearing your MS. And then finally coming to the pros and cons of our department. So I love orthopedics. It is a very, very good, decent, dynamic branch because of its merits. That is, you can make the patients mobile, which is the most important thing for a human being. You can make them mobile, you can make them walk, right? So that is what I feel very happy and satisfied. So you get these intense satisfaction soon after the surgery because you know how you have performed, and you can see the x-rays, and you can actually tell them that you're going to walk after 2 weeks, you're going to walk for 3 weeks, like that. So it is very, very highly satisfying branch, and it is very dynamic. You have to always be on your toes. You have to always have this clear mindset. You have to always have this focus everywhere, like even in OPD, your casualty, OT, especially in OT, a lot of focus is required for this branch. So you have to be, again, I'm repeating, physically and mentally very strong to perform this surgeries, right? And then the cons are, obviously it is very tiring. You have to be 24/7 available, and sometimes now the competition is really high. It's really high. So now it has been shifted that the budding surgeons are being shifted to 2 tiers, where you have to practice for a certain period of time, then come back to the tier 1 cities. And the family time, that is what we have to sacrifice. So the family time you have to sacrifice for being the best one in your field. So again, you should keep upgrading yourself. You need to attend a lot of conference to know latest techniques, because as a surgeon you have to understand what are the new advances for making the patients feel better, right? So these are all the cons. And finally, coming to the important part, the female factor. So here the female factor is, to be actually frank, I have not encountered any male who has tried to bring me down or put me down or talking something bad about me or something like that. Everybody was so encouraging. So everybody wants me to thrive. But what actually matters to you is the life partner. The life partner you choose will decide the fate. Especially for the females, this is the hard fact that you have to digest. So you have to be very careful in choosing your partners, because they play a very important role in shaping your career, especially as orthopedics. So I am being greatly blessed to have a partner who always encourages me, who's always beside me. And the actual drama starts when the kids enter. So I have a baby, 5 years old, and she has to be taken care, and I am the only care provider, the primary care provider for my daughter and for my patients. So you have to juggle in between. Yes, the struggle is real, the struggle is there, but it is all worth it. You can achieve if you are actually passionate about it, if you really want it to happen. So I always believe I am born to be an orthopedic surgeon, so I will be till my end. So this is what motivates me is this. So I want to be a surgeon. I want to be an orthopedic surgeon. So I have done it. I have all my hassles. I have all the struggles. But ultimately, what is important to me is that tag, which I always want, the orthopedic surgeon. So that is what I have achieved, and that gives me a high whenever I feel low. So this is my journey and a bit of the orthopedic residency. If you have any other queries, if you want to know any other thing, or if you want to add anything, you can always do that. You're always welcome. Hope to see you again in our upcoming videos. Thank you so much for your patient listening. Goodbye.